Hi guys, what's up and welcome back to my YouTube channel. If you're new to my channel, welcome. I would like you to subscribe, share and like this video because you're going to be getting a lot of information, a lot of perspective, a lot of value from watching this video. And if you're a returning subscriber, thank you for always coming back for more. So this 2025, you should already know that health is wealth. It's better to prevent a disease or an ailment than actually curing them. I'm not saying that you already have it is already is the end. No, I'm just saying that it's better to prevent an ailment or infection or a situation of sickness happening than actually treating it. It's more less expensive, is less bothersome, is less time consuming, is less mind like mental health draining than actually treatment. So, and in this video, I'm going to be talking about basically human wealth. That's the human wealth. So basically, as far as you're already menstruating, you're already maybe sexually or not sexually active, just majorly from the age of 21 years, you should occasionally check some of these vital tests that you take as a woman. Even if you don't do it constantly, but this year 2025, you should try to incorporate some of this to your routine. Like saying this year I have the obligation of checking myself every year. It will really save you a lot of detriment. You could have come earlier, it's already late. You'll be hearing some of those words in your lifetime. And as a woman, these are the five major tests. As a woman, you should be able to put it in your yearly budget, your yearly like motherboard, your yearly vision for the year. Is really important. They are not negotiable. They are not negotiable because you don't know what life might throw at you. And some of these tests, they are not so expensive. As I said, preventive mechanisms are a lot cheaper than treatment mechanisms. So some of these tests are major tests that you're meant to be taking. There are many other various female or woman health tests that you should take, but these are the very ones that if you do them, you might be able to encompass other tests all in one. And the first, and not it's not like it's the most important, just the first in this list is actually doing a pelvic ultrasound. Pelvic in the sense that it covers your lower abdominal region, that's your pelvic region. And this test majorly is the use of ultrasound to check your internal organs. And your internal organs, what I'm talking about here is your womb, your ovary, that's your eggs, your fallopian tubes. It really checks them. You have heard so many women come up with saying that they got married and they were not conceiving, or the conception was not coming as fast as they expected, and they went for scan and they had fibroid. You can't tell me that if such woman was, even before she got married, when she was a lot younger, that she was embarking on pelvic scans, that would not be a surprise to her. Some of these, especially fibroid, they come as symptomatic. That means it comes majorly without symptoms. You might not even know that it's growing in you. And if you don't combat it, it keeps on growing in size more and more as you even age. So taking a pelvic scan and they check your womb, they'll be able to know if you have any kind of mass, which is majorly fibroid. And they also, hear a lot of women say that they went for scan and they discovered ovarian cysts. Some of these women that don't have regular periods and you feel it's not normal. When you don't have regular period, it can impact on your reproductive structures. That means some of those organs might start malfunctioning. And one of the cases of that malfunctional reproductive system is that you might start developing cysts. You have heard of a lot about cysts, and I know that if you want me to talk more about it in my next video, I can bring a whole video just dedicated to ovarian cysts. It's a really major uprising medical condition for women that they're not even they're not even in their mid 30s. It happens to some people even in their 20s. Yes, fibroid and cysts are not happening to people in their 20s. So you cannot say I'm so young for this. Nah, it's not happening to even people in your age range. So to combat ovarian cysts, some of these things is not caused by anything. You can't say if I take this or if I embark on this and I have ovarian cysts. They don't have any causative agents. So that is why you need to check yourself you by always going for at least routinely, even if it is once a year, a pelvic ultrasound scan. Then the second in my list is actually in the same category of radiology is the mammogram. Yes, that means checking your breast, like checking your breast, your mammary gland. You can never tell. Things are happening these days, and the health, like some people are coming down with a lot of breast cancer, breast lump, and breast health challenges. And some of these women they might not even know until it graduates to even more severe situations. So if you even if you don't have any symptom, you don't have pain, you don't have redness, you don't have any kind of itching, any kind of abnormality physically that I can see, I really advise at least 1 year you should go and do a mammogram to just check your pelvic, your 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 mammary gland, that's your breast. Can tell. We don't pray for such, but at least if you really discover it on time, it helps you to combat it on time. So it's not advance to even cancer and even major breast lump. All right. Some of these tests like mammogram, at least it ranges from 12,000 to 10,000 depending on your locality. So it really comes really handy for women as far as you have a woman, you and you have breast. Of course, you have breast. You should take your mammography like challenge very seriously. Then coming to the lab sector, of course, you have already heard about the prevalence of cervical cancer. It is really uprising now. It is as if it's a wildfire. People, most in the, I think for all that like before in the past, people don't really recognize of that somebody can come down with cervical cancer. But at least a lot of awareness have made this possible to be able to tell people that people can actually come down with cervical cancer, and it just but it can be prevented on time. In this case, you are preventing it. That means you take injection, you take just like hepatitis, you take injection, you take preventive drugs that will make you not to have cervical cancer because it comes down in a lot of women. It comes down in a lot of women. This is just the lab takes they call it the pap smear. So you take a pap smear and they will really check if you have cervical cancer, and if you don't have, there's injection for it, and that means you have to come routinely. If you are under the age of 21 to I think 29, you should come every 3 years to renew your pap smear injection. Then you're under 35 and below, you can just extend it to a minimum of 5 years, just to show you that women should take their health seriously. Cervical cancer is really on the increase now. We don't hope for anybody to come down with it, but if you try to prevent it on time, you might help yourself by ruling out cervical cancer for yourself. Then, so the fourth and not the least is actually going to the lab and demanding to have just to check your yourself. Like if you're free from infection, STDs, viral infections. Some of this might include staphylococcus, the popular staphylococcus aureus, and I think other ones like gonorrhea, syphilis. Some of these major STDs they have symptoms, but some of these toilet infection like candidiasis and very minute toilet infection, they don't really have symptoms. So you need to really check. Not saying all the time, but routinely, whether you have symptoms of them, signs of them, or not. If you even if you don't have foul discharge, you don't have inches, but you know you're sexually active and you share toilet with some people, like people that live in hostels, that shared apartments, you should check if you have any kind of infection. Because what this does is when you don't treat if you have any and you don't treat it on time, kind of causes reproductive challenges like blockage of tubes. Because some of these women that are looking for children and they are already saying that their tubes are blocked, they didn't know. And it was little things like toilet infections or major STI that they didn't know to be treated on time. So that is why, and some of this are some of the things that they don't know if somebody will tell them to do it today. So I'm now that your big auntie. Even I've not reached that level to tell you to do some of this. This might not cost you so much. Oh my God, because there's no amount of health is wealth. When you have health, you save a lot of money. So if you do some of these things, you might be saving a lot of money. And this is the bonus for in all this is to have visit your dentist. A lot of people see how people have been complaining about the as early as in the morning, people already having odor, they have mouth odor. That should not be what they talk about. What they should not ever put mouth odor and a woman in the same sentence. But you have come to know that some people they don't even know they have mouth odor. Yes, they brush their teeth to their own extent, but people complain about mouth odor, and most people don't complain to them. They just gossip to other people. So whether you have mouth odor and somebody have never told you have mouth odor, it's good to visit your dentist because there's an abnormality about bad breath, which is halitosis, which you just have just have bad breath for no reason. It doesn't especially about anything that make you to have a wholesome living. Know where to subscribe and like this video and share it to your family and friends. It will help this video to get to a larger audience. To my next one, bye.